Can you do I want to do a couple emails here?
Sure.
All right, this is from Emma. I suffer from sarcoidosis, and I believe that the Marshall Protocol can help. Can you tell me exactly what this is? I have looked at various websites, but I'm still none the wiser, except some believe in vitamin D and some don't. And, of course, we haven't even gone there yet, which I definitely want to do. So what do you say to Emma?
Well, sarcoidosis was the condition that the Marshall Protocol was developed for. Sarcoidosis is from a pathology point of view, is recognized as a persistent infection. It's also recognized as an autoimmune disease. So it's a condition that's very responsive to the Marshall Protocol. The vitamin D aspect, in sarcoidosis, you shouldn't be taking vitamin D. That even all the board-certified internists would say that, because sarcoidosis is a condition where if you take vitamin D, you'll actually get into trouble. The vitamin D component of the Marshall Protocol.
Oh, it's very curious, isn't it? Man, you talk about your head exploding. You know, you read that and go, "What's going on here?"
Yeah, that's a huge topic.
Right.
Basically, the main thing to understand in vitamin D is that vitamin D is not a vitamin. It was named a vitamin just because of how it was discovered, but it is actually a hormone.
Mm-hmm.
And the one of the ways that the bacteria persist is by disrupting a receptor that is activated by the hormone we call vitamin D. And so when that happens, you get a change in the blood levels of the vitamin D metabolites. And that's what they're finding now in all of these studies.
So the L form actually messes with the vitamin D receptor in an effort to stay alive.
Yeah.
Because what does it do to the vitamin D receptor?
Well, the vitamin D receptor is the thing that turns on the immune system.
Okay.
Okay, so as I say, you get to be really appreciative of how the bacteria have developed survival techniques.
Mm-hmm.
So what happens is when that, really to take a very complicated
keep
scenario,
it simple,
is when that happens, the commonly tested blood level of vitamin D is suppressed, so it's low. And so when you measure vitamin D levels in people with MS and with cancer and with these chronic illnesses, it'll show up low.
Which is like just D25?
Yeah, the 25D.
In a blood test.
Yeah, and so what happens is because even the researchers are still thinking of vitamin D as a vitamin, they assume it's a deficiency. And therefore say, well, these people are vitamin D deficient.
Give them vitamin D.
Give them vitamin D.
Wow.
The trouble with that is that, number one, there's been very few studies that have shown any benefit to supplementing with vitamin D, and in fact, there's some that show it's detrimental. And the second is, it's like saying to someone, if we go with the thyroid, you have that.
Yeah, the thyroid. Yeah.
You measure the person has low thyroid. The assumption is, well, they're just hypothyroid, and you put them on thyroid.
You mean a high TSH number?
Yeah.
Okay.
You put them on thyroid medication, thinking that that's what's wrong with them, and you may mask one symptom, but the process that's causing that high TSH continues on and will show up somewhere else. So it's a misunderstanding of the process.
Wow.
So now, again, initially with the Marshall Protocol, it was thought it was this high level of the active form of the hormone, the so-called 125D, that was creating all the damage. And so that's why in the early expression of the Marshall Protocol, there was this really, really strong emphasis on avoiding everything associated with vitamin D. We now know that's you certainly don't want to ingest vitamin D because it works differently, but the amount of light avoidance and sun avoidance and that is being modified to much more to person's tolerance.
And you can still, eggs have vitamin D that they won't.
They do, but the amount of vitamin D found in foods is really quite small and quite rare. So yes, eggs do have vitamin D in the yolk, but it's only like 20 units. So again, once a person is starting to go back into normal functioning, including normal vitamin D metabolism, then small variants in diet, so you could include some naturally formed vitamin D, is permissible. It's not a deadly sin. We also, from a cholesterol point of view and all sorts of other points of view, one just shouldn't be eating 5 dozen eggs a week anyways. There's there's been research that shows people who have too much eggs in their diet can have health problems. So, it's moderation, like our mother,
Yeah, so walk us through this. So say someone has an autoimmune issue because of bacteria, right? Stealth bacteria. Mm-hmm. So the autoimmune the immune system is just kind of wacky, and maybe it attacks the thyroid, and maybe that presents as a high TSH level, mm-hmm. right? And then you take vitamin D3. What happens then?
Well, if you take vitamin D3, you can suppress the immune system.
The immune system.
So you can actually get a palliative. In other words, a person may temporarily feel better.
Okay.
But their immune system is even further depressed. And
so
then they could start getting into another problem. It's like...
Oh, you mean then the L form can get more active?
Yeah, then they can go back into a more aggressive typical form. It's like using corticosteroids. Why doctors no longer use prednisone as readily as they used to is because, if you have an inflammatory arthritis, I put you on prednisone, you're going to love me because your symptoms are going to go away. But 6 months later, you might die of pneumonia because your immune system can't deal with bacteria.
I hate it when that happens.
So that's why the rheumatologists don't use corticosteroids in treatment of these inflammatory conditions unless necessary now.
But Doc, we interviewed the vitamin D council guy a month ago, and these guys and everybody time you turn on the radio, and our station here has been part of it because I don't know, it sounded good, 50,000 units of vitamin D a week, man, and you're not going to get the flu, and so we need to really rethink this.
Yeah,
wow,
big time. It's going to be one of those things where
kind of like we're going to look back and say, "Oh my God, what did we do here?"
Yeah, exactly what's going to happen. But
jeez.
It's and medicine is full of this. I mean,
sure.
It's in all honesty, doctors aren't very scientific, and it's understandable because the Hippocratic Oath. The primary thing is to help people end suffering. Mm-hmm. So if you have something that you can provide somebody that gets them out of suffering, you give them an antidepressant to make their moods higher, then that's good medicine, However, it may not be good for the person's longevity. And this is why you have, the naturopathic approach to medicine. They'll often talk about healing crisis. Oriental medicine, you insult the body to get it to start working properly. So you stick needles into the person, or you burn moxa on their skin, or on the needle, or heat it up, or you give them a herb that's toxic, because the whole point of Oriental medicine is to insult the body to get it to respond, right? So if you go to an Oriental practitioner and say, "Oh my God, the day after you gave me that herb, I was sick as a dog," they would say, "Good," right? They would say, "Great," because that's what we want to happen. If you go to a doctor and he prescribes something, a North American doctor, and he prescribes a medication for your stomach, and you come back the next day and say, "I'm worse," they'd say, "Oh my God, we have an adverse reaction. We better change the medication." Because the North American doctor, their primary interest is to change your symptomatology.
An emailer wants to know, they are from Omaha, Bruce, would the doctor advise using the Marshall Protocol for someone who's relatively healthy, 50 years old, but I really would like to get rid of these guys so I can live to 100?
Yeah, well...
That's a good question.
It is. And from what I know, theoretically... If you are all interventions that are aimed at promoting health work better the less ill you are. If you do the natural remedies for cancer before you have cancer, you're going to have better results. It's going to prevent you from getting cancer, say. But if you have metastatic cancer, then sometimes you've gone too far, and those natural remedies to get rid of cancer may not work as well, right? So yes, that is a very good question, and yes, and theoretically, from what we know, if you took all the Marshall Protocol medications and had no reaction, then that would say your body is in immune tolerance. That even though may theoretically have we know you have bacteria, as they say, you've got more bacteria on you than you, but you're intolerant. In other words, there's no need for further intervention. If you do react, if you do have so-called Herxheimer reactions or increased symptoms in response to the medications used in the Marshall Protocol, then it means that you do have some bacteria that your body is now identifying, getting rid of, and you will feel improvements in your function. And it's amazing. The person, that questioner, they may have symptoms and they may be less functioning and they may be putting down to I'm 50. Right? I shouldn't, that's normal for 50. Well, it may not be normal for 50.
Yeah, see, I was about, I've been thinking about that all weekend, Dr. Blaney, is what if very few of us really know how good we could feel?
Exactly.
I mean, isn't that an interesting idea? Mm-hmm. Like say, well, wait a minute. What if none of us know how good we could feel? Mm-hmm. Wow. Mm-hmm. I'd like to explore that. Here's an email. Dr. Blaney, my wife was diagnosed with ADHD when she was 13. Wow. She's now 31 and may be completely irrelevant to the below, but included since it is a medical diagnosis. In 2009, diagnosed with fibromyalgia, chronic fatigue, lupus, Hashimoto's. Wow. It seems any medication she takes for one aggravates symptoms of something else. What can we do to increase her energy or health? I mean, would she be a candidate for this?
Yeah, that actually is that's a very common history.
Kind of a classic candidate.
Yeah, like when I first started investigating the Marshall Protocol, etc. It's kind of one of my rules of thumb is I tend to use myself as a guinea pig. If I come across a therapy that I think would be of benefit to my patients. Unless it's open heart surgery, I tend to try it myself.
Well, I was going to ask you, have you done the Marshall Protocol?
Yes, I have. Yeah.
For how long?
5 years.
Are you kidding? Mm-hmm. You had reactions for 5 years?
I had reactions. Probably. I'm still having little reactions, but I would say I haven't had much reactions for about a year and a half to 2.
And why continue with
because I have little ones, and as I say, I'm experimenting, because theoretically you should get to the point where you can take these medications and have no response. And I have a residual level of tinnitus, which is ringing in the ears, which is one of the reasons I tried this protocol in the first place. And now it's at a level of 1 out of 10, once or twice a week, versus before it was 10 out of 10, 24/7.
What other kind of results have you had from it after all this time? I mean, positive results.
Oh, well, positive results. Cardiac. I had a what's called a conduction block. I'm not going to get into details,
sure.
But I had a heart arrhythmia of significance that's completely gone. My blood pressure is normalized. I don't have any. I'm an osteopath. I do osteopathic work. I'm an MD, but I trained in Michigan State in osteopathy, and I was getting what are called ganglions, like little weakness in the connective tissue and ligaments that were showing like little bumps around the joints in my hands. Right, and those disappeared. My cognitive functioning is way better. Like again, I put it down to stress, etc. But I forget person's name, or I would forget what I was going to the fridge for, or all those things that one puts down as being fairly normal when you're in your mid-50s. Well, that's not happening at all anymore. In fact, I've taken up playing the mandolin. I've taken up playing the piano. My ability to learn is back to what it was when I was in medical school.
Wow. Now, what kind of, there's got to be, no, I shouldn't say got to be, but one can suppose, just coming from 25 years in the natural biz, taking antibiotics for 4 or 5 years, it's no, I won't use the term. Is there downsides to that on your body?
Well, yes, it's interesting. As you progress, the antibiotic, as I said before, first of all, the antibiotics aren't as important anymore. They're facilitators. So,
you mean the Benicar is the most important?
Yeah, the Benicar is the most important. So actually, I'm only taking a very small amount of antibiotic once, maybe every 4 or 5 days.
Oh, I see.
And even when you're taking the most antibiotics on the Marshall Protocol, you're never taking it all the time. You're taking very low doses, and so you don't get into problems of resistance. You don't get into problems of altering your bacteria, because the antibiotics that are used are what are called bacteriostatic. In other words, they just interfere with the ability of the bacteria to metabolized. So they're not killing them. So
I see. So they're bacteriostatic. I didn't understand that with the bacteriality. So they're not kind of like a penicillin where they go in and shock and awe.
Yeah. And so, now some people will have very strong immune reactions, and so they may have to be very cautious with the antibiotics. They may have to take even smaller doses or less frequent doses. But as we say, we now know that the main emphasis of the protocol is to use, by using so-called off-label use of Benicar, that it actually activates the receptor that helps the body's innate immune system work better. Part of that innate immune response is the body produces its own antibiotics, and that it's those what are called antimicrobial peptides. Mm-hmm. Doctors like to put all these big names, but it's our own antibiotics that our body can produce, which are much more user friendly. They're much more effective. Again, all of this just comes back to deep respect for nature, in that these bacteria that are out there are incredible organisms that have great capacity of survival, and we have to give them due respect. And our immune system is incredible in terms of its efficiency and how it can do things without damaging our body in any sort of way. And unfortunately, we've got ourselves into a circumstance where we need help, and so in that help, that's why we have medicine. And in that medical field, we have all sorts of remedies out there, so-called in the natural form and all the way into the pharmaceutical form. And some of them are very helpful, some of them aren't so helpful, some of them are necessary in certain situations, but have side effects. There's nothing out there in the world, in my opinion, that's bad for everybody and good for everybody. So what the Marshall Protocol basically is through serendipity and trial and error, and now being more and more supported by the research and science, is that we do have medications that can support people in recovery. So this last emailer, this is, as I say, what happens is in my own case, I track back my dealing with bacteria back to when I was 5. When I started getting boils on my skin that were treated with penicillin and then that went away, and then I started getting sore throats, and then that kind of went away, and ear infections, and then that kind of went away, and then it became more a behavioral thing where I'd have temper tantrums and that, and then it got into another manifestation. So in my 20s, I started having heart arrhythmias, and then, but as I say, our body is incredible in terms of how it can survive. And so these things wax and wane and present in different ways. So this woman, manifested ADHD when she was young. That probably dissipated. Now all of a sudden she probably started getting fatigue and fibromyalgia, and then that kind of moved into, Hashimoto's and lupus and that sort of thing. And that's where doctors can be skeptical. They say, well, how can one thing cause so many different presentations? But when you start looking at the science, you can understand it. Here's an email from Doris in Southern California. She said, I have read and my doctor is suggesting that I take a test of 25 vitamin D, 125 vitamin D, and ferritin to see if I am a candidate for the Marshall Protocol. But I'm wondering if I've been taking vitamin D supplementation, that will skew these tests. Good question. It will skew the test, but sometimes what will happen is the person will be on vitamin D supplements, and the 25D will still be low, and that's confirmatory as to the body is dysregulating vitamin D. Now, one of the things the person can do is they can stop taking supplements for a month or so prior. What would you prefer as a doctor? It doesn't matter. It depends on how you interpret. I've been doing this for so long. I'm pretty good at interpreting what the results are. Mm-hmm. But if one's trying to look for the classical low 25, high 125, then it would be better to stop the vitamin D for a period of time for about a month or so, because then you get rid of that immune suppression effect of the vitamin D. And then ferritin? Ferritin is a protein that binds to iron, and often will go up when there's inflammation. I wrote a paper on it, and I analyzed 100 patients with chronic illness and autoimmune disease, and looked at these inflammatory markers, one of them being ferritin, one of them being C-reactive protein, and the vitamin D metabolites. And the disruption of the vitamin D metabolites was positive 85% of the time. I think the ferritin was in about a 10%, 8 to 10% of the time. So it's not a strong marker, but it is a marker. What I do in my practice is I tend to check for a number of inflammatory markers, cast out a big net. Because, again, depending on where the person's immune system is, as the person advances in an illness, sometimes the body's ability to respond gets distorted, and so sometimes you have to kind of throw a big net out to see, and you might only get, it's rare to get only a high ferritin, but...
what about CPK? Isn't that an inflammatory thing?
CRP.
Is it CRP?
CRP, and the other one is CK. CK is an enzyme for muscle breakdown. It's, again, I just was finding that occasionally I found that high in people because I'd have a fibromyalgia patient or a person who had muscle pain. You want to rule out that they don't have some, metabolic disease that's breaking down their muscle, or if they're on a anti-cholesterol drug, you check that because sometimes it'll go up. And so I kind of found it a little bit up in certain people, but it really wasn't a strong marker. The most sensitive marker is definitely the vitamin D metabolite. And
omega-3s, now some are saying that these might not be good in the pharmacological doses that everybody's taking.
Yeah, well, that's because the body's immune system does a number of things to try and get rid of bacteria. One of them is to produce these oxidizing agents. And so a lot of the antioxidants that are promoted could actually be sabotaged in the immune response. The omegas, again, it looked like a good thing, but now when they're starting to actually do trials, they're finding that maybe they're not doing very much, and maybe in certain situations they may be being counterproductive. When I was young, one of my mentors in nutrition was this eccentric old man, and what he said to me in terms of diet, he said, eat whole foods wholly. So his whole thing was, a vitamin is a processed food, just like sugar. And so the best thing in terms of diet is to eat quality foods, and they're as wholly as possible. And if you do that, you probably don't need a lot of supplementation.
Jill wants to know in Seattle if a vitamin C IV will kill the Th1 pathogens or ultraviolet light blood transfers. That's where they...
that will kill the typical forms in the blood, but the biggest problem, as we've already said, is the atypical forms inside cells.
They won't get.
That won't.
How about another email? Well, we have lots of emails. What about... iodine? I mean, it's like the supplement du jour. It's everywhere, right? 5 drops or 3 drops of Lugol's iodine. What if somebody just takes this listening or is taking it now? Should they be thinking about anything other than just taking it? Could this be doing them harm?
It's not. I don't know if it can do too much harm. I mean, I suppose any nutrient take too much could give you harm, but it's more is that it might, if the person is lacking in iodine and they supplement with iodine and they get better thyroid function, and that then will affect positively the immune system. In certain individuals, that may be all that's necessary for them to get back into what we, as I say, cause the immune tolerance. But at the same time, it may not, and then it may just, they may need to move into looking at other aspects that could be contributing to their health issues. So, as I said, it's really, really rare in my experience that one thing corrects. And even in terms of the Marshall Protocol, I say to people, there's 2 things we're doing. We're treating the cause, which in our experience and what's being supported by the research, the Marshall Protocol is very effective at getting rid of these L-form bacteria and normalizing the inflammation. But you also have to deal with the consequences, and sometimes the consequences requires supporting the hormone system, requires corrective exercise, requires improvement in diet, it requires changes in lifestyle.
Lots of questions about vitamin C, and I'll just repeat then. And there's some people are talking about even 80,000 grams or 80,000 units of vitamin D per day, that kind of thing. So in general, it doesn't go after the L forms at all, the vitamin C.
Vitamin C?
Yeah.
Vitamin C is basically, it's not in pharmaceutical doses and very high doses. It's a toxin, and so it's only going to get at typical forms. It's not going to get at atypical forms because the atypical forms are dormant, right? You can't be walking around with an IV infusion of running 5 grams of vitamin C into your body all the time. You're always getting these pulses. So vitamin C can be very beneficial as a specific therapy for but it's not, in my experience, it's not going to be curative, right?
So, we got to touch on before we get out here is the teeth. Dr. Bob Marshall here in the Austin area talked about biofilms 5 years ago, and if you had bad metals in your mouth, and then all of a sudden it mixes with the saliva, you got these biofilms. I never understood what they are, and then now we're going to see Dr. Hal Huggins again on Wednesday night here in the Central Texas area and do a little thing with him, and we've had him on the show, and he talks about how toxic the root canals are. Give us your little couple-minute feelings about the significance of oral pathology with the L form and these bacteria.
Oh, it's huge.
It is big, isn't it?
It is. Yeah. And but interestingly enough, it's that's one of the consistent improvements we'll see with the Marshall Protocol is the periodontal disease results. So I think one has to understand, just like the doctors are now saying, periodontal disease can and does cause heart disease. In other words, it has systemic effects. And therefore, you need to treat it systemically also. So it's, but no, I worked for 8 years with a biological dentist, and so the problem of amalgams, the problem of root canals, people don't realize that each tooth is full of these little tubules, right? And I think it's estimated that each tooth has 2 miles of tubules. Well, those little tubules harbor bacteria. So you have an infected tooth, you get a root canal, it kills the nerve, drains the pus, and you think you're fine, but that tooth is still infected, right? And so it can then cause systemic effects. It's like it's one of the areas that harbors these atypical bacteria. So now I've found in response to the MT, some of these root canals, teeth, the body can actually get them back to a more healthy state and don't necessarily have to take them out.
Really?
Because one of the problems with treating root canal teeth by extraction is then all of a sudden person's got no teeth, and then they have to look at implants where you're putting a metal into the jawbone, and so but yeah, the dental hygiene or the dental pathology is, I think, one of the contributors to the chronic illness out there. Because, again, as I said, there's and the research is supporting. Type 2 diabetes is an epidemic now. We're having 8 and 10-year-old kids with type 2 diabetes. As I said, there's people with Alzheimer's starting to present in their 40s. So there's an epidemic of these so-called illnesses of civilization, and so what's causing it? Well, one for sure is the dental interventions that have been going on, where we're sticking amalgam into teeth and root canaling teeth. Weston Price was talking about root canal teeth causing inflammatory conditions back in, the 30s, I believe, right?
A lot of folks have some high hopes for this zirconium as an implant.
Yeah.
What do you think? Do you have any idea?
It may very well be a good option, right?
Yeah, it'd be nice to have something you could put in there if you got to pull these root canals out, Doug.
Yeah.
So, okay, in closing then, in general, would you have folks go easy on the vitamin D at this point till we figure more of it out, or?
Yeah, I would.
Because everybody's taking it.
I know. Well, as I said, it's a very, very charged issue. If one takes the time, and when I first was exposed to this, I had the initial skepticism too about it. But when you go actually go into PubMed and do the research type of thing, you'll find that there really, really is very few, if any, reports that show a benefit with supplementation. There's lots of reports that show that the 25 level is low, but that doesn't mean that that's a deficiency. So I think people should use common sense, recognize that it's a fat-soluble pro-hormone. And so if I was saying to people, in order to be healthy, I want to put testosterone in everyone's milk, I think most people would look at me and say, you're crazy. But if I called that testosterone vitamin T, then everyone would start going, oh, well, that's not a bad idea because I've blessed it with the term vitamin. So I think the first thing to do when people think about vitamin D is to, first of all, drop the word vitamin and say hormone D.
Hormone D.
Do I need hormone D? And if there are doubts, if they check, if they have very, very low 25D and very, very low 125D, which I've seen very rarely, but it's possible that person might be actually, for some reason, vitamin D deficient. But I would say use common sense, not go high dose.
You think all the D3 or vitamin D, hormone D supplementation in the milk and cheese over the last 50 years, that we could wake up someday and find out that this is not good as well?
People have already published about that. Yeah. There's one recent paper that's associated allergies with the supplementation of D.
Well, it's a jungle out there, Doc.
Yeah, it's fun.
Well, it's been an honor to have you on. Now, your website is stillpointproject.com?
Yep.
Do you do patients? Do you take care of patients around the country? Or
I do consults with people from around the world, yeah.
And that must be rewarding for you.
It is.
Well, we'll stay at it, Doc, and keep reading and keep learning, and I appreciate all your time that you spent with us this morning. It's been an honor to have you on the show, and I think you've helped us learn a little bit more about this very complicated and intriguing subject.
Well, thank you very
Dr.
much
Greg
for having
Blaney.
me on.
Yeah, it's been an honor. Thank you. Dr. Greg Blaney, my name is Patrick Timpone. Thank you all for coming by. Quick little recap here. On the 17th, Dr. Gabriel Cousins, who's always fun to talk to. He's into some interesting work in South America. We're going to talk to Dadis Kazarian about the thyroid autoimmune issues and continue our conversation and talk about D3 with him, this hormone. David Wolf, who's a raw food guy and one of the superfood super guys around the world. David Wolf on the 22nd. And then, let's see, tomorrow we're going to do a little bit of forecasting and also predictions of the future from a lady who actually communicates with people not from planet Earth. Now, you know that's going to be fun. That'll be tomorrow morning at 10 o'clock right here. Andrew Goss said Wednesday. Dr. Robert Kassar, who is a longevity guy, on Thursday. All live every morning, 10 a.m. Central Time on OneRadioNetwork.com. It is an honor for me to be here with you each morning, OneRadioNetwork.com. Please pass on these links to everyone that you care about. We're free for you 24/7 on OneRadioNetwork.com. I love you all very much. See you tomorrow morning at 10 o'clock.